so go ahead and introduce yourself.
All right. Hey, my name is Ravi, and by profession, I'm a software engineer. I live in Dallas, but I came into Salt Lake City, just for this surgery. Of course, my teeth. I mean, I have, I think, a medical situation. I guess. I don't know what it is technically called as, but I can really see it. So that makes me nervous, And initially, of course, I didn't get used to get too conscious about it. But then again, nowadays I do a lot, and that kind of doesn't feel good. Although I'm not, I don't mind speaking and stuff like that, but it just but besides being a software engineer, I mean, sitting all day drinking, sodas and eating snacks and all these things eventually pays, eventually shows up, right? So I guess to all those IT engineers, if you ended up some situation like this, better see Dr. Hendricks.
I appreciate that. So you flew all the way in on one day,
Yeah.
and we talked, and it was awesome, and got to know each other. And then you flew in. Was it last night or today?
I flew in Sunday morning.
Sunday morning.
Yeah. I just wanted to make sure some arrangements are done and things like that.
Good. So we've been spending the day getting data. We took a new CT. Valentina, why don't you go ahead and move that around a little bit so they can kind of see that. So this is a scan of his teeth and gums that we're going to use to adapt to build his dream smile. And super, super excited to do this. So we've been putting pictures together here. And we are loading them into our software to be able to start designing his final smile. But I'm kind of old school because I still like to have a physical copy, because I have had it happen a couple times where I've come in on a surgery day and our software doesn't work. And so I like having a physical copy as well. I think it's good for the patient too. And whenever you come in, you can look at your chart, your physical chart. So we have a physical one as well as a digital. So this is awesome. So tell me, Ravi, what is it that you're looking for in your new smile?
It did make me nervous, the whole procedure, but then, all I want to see is the Hollywood style smile. The perfect one, not the ones, that has ups and downs.
Yes.
These are not the right people to have ups and downs.
I love it. Is there any celebrity smile or musician or something like that you really like their smile that you want me to look at
I would rather make my own identity, and I'd let
authentic and real
and choose
awesome
which one makes best. I think with freedom I'll give the responsibility.
I love it. You're becoming my favorite patient very quickly. I have to be careful when I say that because I have a lot of my patients that watch these videos. But the ones that typically trust me more to have the freedom they're the ones that we get to the best smile quickly. I think that everyone has their own journey, but a lot of times I can see what's going to look good in someone. It's kind of one of the gifts I have is I can just imagine what a smile will be like, but some people don't see that. They don't know until they've seen it themselves. And so in the past, when I have someone that has a really strong opinion, I'll show them what it looks like, and they'll be like, yeah, maybe I'll just let you just decide. And so awesome. Okay, so when are we doing surgery?
Tomorrow.
Tomorrow.
Yes.
Okay. What's the biggest questions that you have for me? You can hit me with the hardest questions, or if there's anything that's personal, you obviously can wait for that. But anything that you think would be worth other people hearing.
Well, I know I have to follow a certain diet, just
Yes.
to make sure that those things are in place before I start jumping on all sorts of foods and stuff like that.
Mm-hmm.
So I think that will be the biggest challenge for me, just to make sure, although my spouse wants me to lose weight, so I'll take that as an opportunity to get on the liquid diet altogether. But anyway, jokes apart, I think watching all those videos that you have already put out there, I don't have a lot of big questions per se, because almost all of them
Been
have
answered.
Okay. All I needed to know is what I'm going to do next.
Okay.
And I think this is a good time to figure this out.
So yeah, soft diet wise, it's one of the harder things for especially males And we do provide you a list. We'll give it to you. Do we give it tomorrow?
I do have the list.
Oh, do you already have the list? It's a list that we're always adding to, and we've had a patient in the past that was a nutritionist that I'm going to give you her information. She put together a little book, Pass It Forward, and she's great. And if you have questions, she can be like a mentor. I don't know if anyone's taken her up on this offer, but it's great to have someone that knows who's been through it, right? But she put together a little bit of a gift for future patients, and I'll give that to you as well. But diet-wise, the biggest things is your all-American diet of steak, chicken, hamburgers. You gotta put that on hold.
I'm a vegetarian, vegan.
Oh, are you?
I'm
Awesome.
Any kind of meat, so we are cool with that.
I love that. So this is something that she put together that I'll pass on to you too. She's a sweetheart. You can read through that. It gives a little information. So important that the day of surgery, just want to make sure that you drink lots of fluids.
Okay.
That'll keep you your heart rate and blood pressure stable. It's totally normal given the amount of the condition you have is just periodontitis, where what that means basically is just you have bone loss around your teeth.
Yeah.
And so when we have that condition, it's very common for the body to bleed the day of surgery. So like, when you go back to your hotel, it's totally normal for you to be just a little bit drippy. Okay. So if there's a little bit of blood coming down the corner of your mouth, that's okay. You look like a vampire, but but it's the way the body cleanses itself. It's just pushing, and that's how it is. So as long as you're drinking fluids, you'll be just fine. Okay. Now, as far as medications, what do you understand? Has she gone over that as far as how often you can take your medications?
I think after every 4 hours.
Every 4 hours. And how many?
That I don't know.
Okay, so I'm old school. I did turn 40 yesterday, and thank you for the gift you brought me. So I like to manage our pain with ibuprofen and Tylenol. I also give you a narcotic just in case you need it, but most of my patients don't. But you use 2 ibuprofen and 1 Tylenol every 4 hours. Okay, and then you also have your antibiotic that you already have. Have you filled that yet?
No, I have not started on it.
Okay, so we'll make sure you get started on that today.
Yeah.
We'll get you to fill that. That's a 10-day course. You're going to take all those, you don't have to take it the day after surgery. The day of surgery, unless you get a good meal in you, meaning that you have something that most of the time people are just really sleepy the first day and they don't have much of an appetite, and that's okay. You don't have to force it. So you don't have to take the antibiotic that first day, but the next day after that, you start taking it, okay? And then, did you go over the other medications?
No.
Okay, so go grab or have them print that real quick. I want you staying here though.
Yeah.
We're also going to prescribe you a steroid that you're going to be taking the day after surgery as well. And the steroid basically comes in a blister pack, meaning at the very top it'll have six pills, and you're going to take all those the first day, meaning that's day 1 after surgery. So that will be on Thursday. Yep. And then on Friday, you'll go to the next line down, and it's 5.
Okay.
And then on Saturday, it'll be the next one down, which will be 4. It's a taper. So you start with 6, then you go 5, 4, 3, 2, 1, and then you're done. Okay. And then, so antibiotic, steroid, and then we're going to also prescribe a rinse. Okay. The rinse is like Listerine,
Okay.
but it's special. Has more bacterial fighting. Okay. And that will be something I want you to do 3 times a day. Okay. And then, here's actually, so this is an example of it here. Kind of see it. So this is great. Some people really don't, this has a decent taste, but it does dry your mouth. It has some alcohol in it.
Okay.
And so if you really don't like the after taste of this, you can use warm salt water as well. Okay. But you have to do something 3 times a day.
I have one. I'll bring it tomorrow.
Perfect. Yeah, take a look at it.
Yeah.
Okay, so, and then questions about...
So the medication that I have to take, including the steroids and the pain medication, do I need to have like a heavy meal before that? Which obviously now it's going on liquid diet. So do I have to take, like, instead of 1, I have to take 2 milkshakes, two protein shakes before consuming those?
Everybody's different. As long as you just don't take them on an empty diet.
Okay.
Try 1. If you feel a little bit nauseous, then do 2.
Okay.
the truth is that you can get away with mashed potatoes, you can get away with soup as long as it's not hot. The day of surgery, we just don't want anything that's too hot because it'll cause you to swell and bleed more. Okay.
Too cold is fine.
Cold's great.
Okay.
All the ice cream you want, but just no ice cream has nuts in it. No raisins, nothing too fun. It just got to be straight ice cream.
I just bought some juices and stuff just to kind of.
Yeah. Some doctors don't like any dairy products, but I would never say no to ice cream. So I never ask my patients to either. If you're a Diet Coke drinker, that's just fine too. You just don't want to swish with it.
How about the energy drink?
Energy drink
That's
was
fine.
great. Fantastic. No problem.
Caffeine in the morning.
That's the only thing I'm gonna consume as far as soda is concerned.
That's awesome. I love it. No, you're fine with energy drinks. That's fine too. Here's your scripts here.
Okay.
And I will sign these really quickly. So, because I don't want to put down here. So one's for chlorhexidine, and then you have one, Augmentin is the antibiotic, okay? And that's the one you're gonna start taking today, and then you can skip a day tomorrow. Now, if you, again, after surgery, if you get a protein shake in you, take it.
Okay.
But no stress. If you didn't take it tomorrow, I don't want it'd be better. I don't want you throwing up. That'd be more counterproductive.
And I guess I cannot use a straw.
Just the day of surgery.
Okay.
You should be fine the day after. Okay. In the worst case scenario, if you use it the day after, it causes you to bleed a little bit. It's not a big deal. You just put a little bit of pressure on it, and then you're fine. Okay. And then the narcotic that we give is oxycodone. It does not have Tylenol in it, okay? What that means is that you take it independent of the ibuprofen and Tylenol. Okay, so that means that you can take the ibuprofen and Tylenol every 4 hours by the clock. Only take the oxycodone if you need it.
Okay.
And again, I stress this, you likely will not need it. Most of my patients, they'll take one, maybe two, and that's it. But we write a few extra because you're coming from out of town. I can't call this prescription in to your state. You know, Texas doesn't like Utah. Just kidding. I don't know. We love Texas. Texas is, Texas would be the second place I'd move to if I couldn't live in Utah. I actually almost moved there once. That was West Texas, Tyler, Texas. Woo woo. Yeah, it's a great place. Okay, so that's medications. Other questions?
That's it, I guess. So this medication, if I have to take it, then I have to take it between the pain medications, right?
Yeah. So the Augmentin you take 3 times a day,
Okay.
morning, afternoon, and evening. Don't get too stressed about being exactly perfectly. That timing of that's not as critical. Okay. Even the steroid isn't critical. I think in the steroid that comes in a blister pack, remember the 6 and then 5, 4, 3? Mm-hmm. That one's not even critical either. You take them, because it says take them 2 in the morning, 2 in the afternoon, 2 in the evening. Mm-hmm. You can take all those at once. Just don't do all of them at once at night, because then you'll be like, awake. So do it like sometime in the afternoon. Okay. If you're like me, just getting me to take a pill is hard because I'm moving so fast. So if you just don't do well with remember to take your pills, set an alarm on your phone or take them all at once.
So the steroids will only keep me up.
They do. They keep.
Okay.
Yep. Okay. Yeah. So don't take them like at 9 o'clock,
Okay.
unless you want to be up. Then use them for their advantage.
No.
But the first few nights we want you to get some sleep. It's really critical. Stress levels go down. Again, we want cortisol levels, which is is because of the stress in the body, meaning physical stress, but also emotional stress. Mm-hmm. So if you have a favorite movie that night, put on Where the Red Fern Grows, or put on the movie that makes you all the warm fuzzies. For me, it's like what's my favorite show? Like I love Braveheart, right? I'm a Top Gun type of guy. Mm-hmm. I could watch that over and over again. Recently, it's the what's the show with the Hugh Jackman and the dancer?
Greatest Showman.
The Greatest Showman. Love that show. I could watch that over and over again. But anyways, any show that just kind of helps you relax or chill. If you do, and as far as sleeping, do you sleep well?
Yeah.
Okay. If you find that like in the first week that you have a little bit more anxiety about this, I can prescribe a little bit of a chill pill in a sense, and sometimes that works better than narcotic. Okay. I'd much rather take a pill to help you just relax and maybe sleep than to put you, the narcotic is, again, it's the worst form of pain control. I hate it. It's just we live in a society oftentimes that just doesn't trust anything else, and so I pre-frame you very carefully, saying that you won't need it, and I promise you, you'll tomorrow you're going to come back and go, yeah, I'm a 2 out of 10 in pain or 1 out of 10. Last week's surgery, she was like 0, right? I think she said 0 out of 10.
Okay, wow, that's nice.
Yeah. So, anyways, as long as you listen, the day of surgery, make sure you keep your head elevated.
Okay.
Okay, that's number one. Second thing is you're going to ice every 20 minutes.
Mhm.
And then the third thing is you make sure you take the medications by the clock. And that's why I want your caretaker to basically just, that's the most critical thing is they set their alarm and every 4 hours you take your medication.
Right.
Okay. They are in charge of the narcotics on day one.
Okay.
You can't give them a hard time because I'm going to deputize them. I'm going to put like a little star on them and say, you're in charge, because it makes me nervous giving patients any narcotics when I know they're not going to be all themselves. Good people make bad decisions and then they get themselves in trouble. So your friend who's here, just make sure they say, hey, you just take care of this one bottle because this bottle could hurt me if I'm in the wrong hands. So questions?
Not really. I mean, I do have questions, if you,
Yeah.
but those are more like, let's see. I did wrote them down.
So tomorrow, if he wants to get breakfast, will be at 5, right?
Yeah, I need to pick this from the pharmacy, so that is done. Any vital signs they are supposed to take of mine while taking care of it?
Any what?
Vital signs.
Wider?
Vital signs.
Oh, vital signs.
Yes.
Yes.
They can take some vitals if you need them.
Oh, you mean at the pharmacy?
No, the caretakers.
Yes.
Oh,
I have a nurse.
I have a nurse. Well, what I would say is if he has, we typically don't have them take any vitals. It's pretty awesome you have a nurse, and so maybe we'll have, we can give him some stuff for him to check it. Yeah, that's a good idea. I like that.
All right. So yeah.
I'm not used to such service. That sounds fantastic. I can call and ask for blood pressure. That's great.
Yeah. Yeah, I think this is more. Okay. Yeah, I have to use a water pick for cleaning up, right? So I need to get that one.
Oh, give me a syringe.
Yeah.
So the first week you're going to use a syringe that we give you. Okay, it'll be like this here. Okay, and this is literally just to kind of, you're going to fill this up with, it could be warm salt water, or it could be the blue stuff, and you're going to just get right between the corner and the device, and you're just going to lightly push this out so that when you look there, it looks like it's clean. We don't want any food collecting there.
Yeah.
Okay. This is something I thought was very obvious, but as of last week, a little more transparent. But after about a week and a half to 2 weeks, now you can transition to a water pick. You're going to start off on the lowest level, like a 1, and then you'll start to graduate to like a 10. I recommend getting one that has all 10, like has a 10 dials. Okay. But yes, I mean, technically, if you put it on 1 and you saw how it feels, if it doesn't hurt and it's not pushing too hard that it's going to pop the sutures, you could use your water pick. I'm always hesitant to tell people to do it because some people's 1 could be like a 5 on another device. You just don't know. So I always say use this first and get an idea, because there's only so much pressure you can push with this, right? And so if you compare that to what your water pick is, yeah, it might be easier for you, and then you could use it. Okay?
I can gargle, right?
Gargle, yeah, no problem. Just, the first day, again, when you use the rinse and you spit it out, just think you just irritated the tissue, which is okay. You're going to bleed a little bit, so don't freak out.
Sure. No,
The most common,
Yeah.
Any which way.
so I'll call you tomorrow night just to see how you're doing and check up on your nurse too. Make sure. Yeah, you'll be able to talk.
Okay.
You might be asleep, and that's the thing is that's why I want both numbers. So if you don't answer, I'll call your caretaker.
Okay.
I like to talk to you first, but if you're not available, I'll talk to them. And but the biggest thing is I just want someone to talk to. I want to know that you're alive and well. We've never had anyone die. I want to keep it that way.
Sure. Happy and
Exactly. I love it. So I was gonna say something. What were you talking about a minute ago? I forgot it, lost it. So I do it live. A little spacey right now. Got so much going on in my mind. I'm really excited for your case. It's going to be incredible. Tomorrow's going to be an amazing day. You mentioned that your family might watch it.
Yes.
And so would you like me to stream it on YouTube?
Yes, please.
You would?
Yeah.
Here you go. So then for everyone that's watching this right now, we're going to stream this tomorrow. We'll do at least the top arch. The top arch is easier to see. On the lower, it's hard to get the camera in the right position, but for sure the top arch will do. And we'll probably turn it off right before I start to show the teeth because I want that to be magic. And we'll stream it so we'll for sure make sure they're live when we're seeing the teeth on Thursday.
Yeah.
Okay?
Yeah. The sutures, right?
Oh, I was gonna say this, the most common thing that people ask me the night of surgery is it normal for you to bleed? And it's like, yes. You have so much in bacteria and infection, it's gonna clear itself out. It's the way the body,
Right.
okay?
And the sutures, they are gonna come out by itself?
Yes, they're dissolvable stitches.
Okay.
Yep.
Typically months?
Somewhere between 2 and 4 weeks.
2 to 4. Okay.
If you get one little stitch that's hanging down, driving you crazy, just clean out some scissors, reach in there and just cut it off. Okay? So make sure they're clean though. Great questions. Other questions?
Yeah, I think that's it. You know, that's all I noted down actually.
Okay.
Most of them are already answered.
Well, I appreciate it. I'm really excited. I think that tomorrow is going to be fun for you and for me. Definitely fun for her. And these two over here. Okay, so we'll go ahead and stop this video. And